Yeah, okay. All right. So this is what we are going to see today, the effect of steam bath on cardiovascular parameters in healthy volunteers. So previously, excuse, there is a lot of confusion on whether to give steam bath in cardiovascular patients or not. Is it advisable or is it not advisable? Whether it is possible to give a steam bath? These are all few of the, one sec. One second, just share the links. We have not got the link. All right. Okay. So now this paper, it is not just going to be only about this research paper alone. We are also going to see a few more publications which supports this particular effect what we are going to see. Okay. So yes, coming to the paper. So this paper was published in the year 2021 by Pandiraja et al. Pandiraja and Associates. This is one of our papers, one of the very few papers available in steam bath, we can say, right? And so this is published in Advances in Integrative Medicine with impact factor of 1.7. Elsevier um, published in Elsevier. We have the DOI and myself, Dr. Venugopal. All right. So this is about the paper as such. So looking at the abstract, so what this abstract actually shows is it's really, really interesting. As you can see here, the systolic blood pressure increased initially after the steam bath, but reduced at the 10th and 30 minutes. That is, the systolic blood pressure had actually come down after giving steam bath. So that is what this paper actually says. Okay. Now going into the paper. So the abstract, as you all know by now, you would have been familiar with. So it's a structured abstract with background, materials and methods, results and conclusion. So in the background section, they talk about hydrotherapy, what is hydrotherapy, and they talk about the steam bath. And physiological changes in steam bath, they are mentioned that it is similar to that of exercise. So this is like something really, really interesting, you can say. The physiological changes observed in steam bath were similar to that of exercise, as the body tries to establish homeostasis after steam bath through a series of reactions, which includes peripheral vasodilation and thereby decreasing peripheral resistance as well. Got issues. One more, one sec. Okay, fine, right. So the physiological changes in steam bath were similar to that of exercise. One thing. So what it does is body tries to establish homeostasis through a set of reactions, right? Okay, through a set of reactions, what it tries to do is it tries to establish homeostasis, because being in a hot hydriatic application, body has to recover by itself. So that recovery, actually it is similar to what is happening in exercise. The increase in skin temperature leads to vasodilation of skin arterioles and sweating. Now the importance of this peripheral vasodilation, that is what we are seeing, or that is what we are actually observing when it comes to the result section. Okay, so we will see that when we come to the result section, you will be understanding why the systolic and diastolic blood pressure actually is reduced. Now, steam bath is widely used for pain management, right? So, in a clinical setup, we generally use steam bath for pain management, weight reduction, and skin-related disease, right? Now, this study, it's kind of it's slightly different, because we actually wanted to check the effect of steam bath on cardiovascular parameters. I remember, like, last week there was a clinical discussion where one patient was having high blood pressure and steam bath was prescribed to the patient, and the PG doctor came running and say, like, the patient's blood pressure is high, so can we give steam bath? And by that afternoon, one patient was having low blood pressure. I mean, the patient was on hypotension. And again, one intern doctor came and asked, like, blood pressure is so low, can we give steam bath? Now, the thing is it contraindicated? Should that be given for, should not be given because of the risk of hypertension or hypotension? We do not actually know. How we can know is only by doing a proper study. This can be shown, this can be proven, and only then it can be clinically applied, right? So this was done in healthy volunteers. So this particular study was done in healthy volunteers. So the materials and methods. So this is a proper RCT done on 80 healthy volunteers. So the intervention group had like steam bath, and the control group had like just the shower bath. Right. So the male female ratio is given below here. Now the inclusion criteria, all participants who gave consent, because it's healthy volunteers. And exclusion criteria are those factors which possibly has an impact on blood pressure, like the smokers, alcoholics, athletes, and someone with recent surgery, so that we don't harbor any like infection through the skins. All right, now the intervention. Steam bath given for 10 minutes. Patient was made to sit inside the steam cabin after drinking a glass of water, followed by cold shower for 2 minutes. So once the patient comes out, he took cold shower for 2 minutes. And subjects from both groups reported a day before the intervention. They came to the the therapy place, and they saw the steam bath. They were given explanation about the procedure, what has to be done, how it would be done, along with the demonstration. Everything was said to the participants a day before the actual data collection happened. In the control group, they just took cold shower. There was no steam bath before. They just took cold shower, and the impact of which we'll be seeing in the outcomes. Right now, outcome measure, what was measured? It's very simple. Systolic blood pressure, diastolic blood pressure, and heart rate. These three things were measured. And how blood pressure was measured is two sequential readings were measured and the mean values were used. Blood pressure was checked like after 15 months of supine rest. Post in lying down position. Again, pre and post, it's done in the lying down position. Immediately after, 10 minutes after, and 13 minutes, 30 minutes after the intervention, to see the effect of both action phase and reaction. Action phase is something to be done within the steam cabin, which is not practically possible. So what the only reading which was available is immediately after, and 10 minutes and 30 minutes. What happens during the recovery period, right? So analysis, one way ANOVA was used, and the statistical significant point was set at 0.05. Now, results. Now, the results, first of all, the heart rate. Now, immediately after the intervention, Heart rate increase in both groups. Fine. The heart rate increase like as high as 20 in the intervention and 18.3 in the control group. Excuse. Why? Because it doesn't matter whether you're giving a cold application or a hot application. Remember, the control group has got cold shower. So naturally, when there is excitation happening to the body through the skin, the first thing that happens is heart rate increases. Fine. So in both the groups, heart rate actually increase. At 10 minutes, heart rate decrease in steam bath. In only the steam bath group, it reduced. And at 30 minutes, there's further reduction in the steam bath group. Okay. Now, the first outcome measure, heart rate reduced after giving steam bath. Fine. The second is the systolic blood pressure. Systolic blood pressure was the second outcome measure, right? So, for this, as far as systolic blood pressure is concerned, now the one at this one, the straight line, the lined one is the intervention group, and this dotted broken lines, it's the control group. As you can see, systolic blood pressure actually increased immediately after, but during the resting period, it came well below the baseline, right? Just remember this junction. Remember this junction when the patient is sitting inside the cabin, steam cabin, either the patient or the participant here. So it's a healthy volunteer, right? So blood pressure tend to increase slightly, but it comes back below the baseline at 10 minutes and after half an hour. Okay. Excuse me. And this blood pressure is somewhat similar to simple cold shower. Right? 10 minutes after the cold shower, this is the blood pressure. We are not talking about blood pressure shooting all the way from 125 all the way to 150 or something of that sort. It's come to 130, which is similar to that of how much the BP was at 10th minute in the control group. Fine. So it was within the safe range. And diastolic blood pressure, the beauty of it is systolic blood pressure is much more easier to reduce. Right? Systolic blood pressure, it's mostly because of your heart rate, and the cardiac output majorly determines your systolic blood pressure. So whenever we are stressed, whenever we are walking, like say for a longer distance or something, even the stress related things, all those increases your systolic. But diastolic blood pressure, it is mostly depends on your blood vessel resistance, your vascular resistance, right? So what we found here was diastolic blood pressure significantly reduced in the intervention group. Okay. So there was outright, like even immediately after the steam bath, the blood pressure readings was lesser than the control group, right? Which kept like the distance remained only higher between the control and the intervention group. And this number was quite interesting because in a normal clinical setting, in a normal clinical setup, we don't see reduction of around 10 points, right? We don't see the reduction. I mean, it should be mmHg, not beats per minute. We don't see a reduction of 10 mmHg after most interventions, that too in diastolic. This study was, it was really interesting. It's not that like we know steam bath is good, let us give and let us see how it goes. It's not of that sort. We want to see whether it is beneficial or not beneficial, whether it is harmful, whether it is not harmful, whether it is working or not working. It was really surprising to see that the diastolic blood pressure significantly reduced to around 10 mmHg. Okay, the numbers, the absolute numbers are given here in the table. As you can see here, the heart rate in the intervention group immediately after increased to 20, but reduced after 10 minutes and 30 minutes. Control group, again, it increased, but like what to say, marginally it increased after that, after 30 minutes. And systolic blood pressure reduction throughout in the intervention, but there's no much change, like +4, +7, +5 after the cold application. Okay. Likewise, the diastolic, as I told, like around 10 mmHg difference could be seen. Now, discussion. Excuse the discussion part. Significant reduction in blood pressure following steam bath is observed in healthy volunteers. This is in line with previous findings on sauna bath. Now, here, the moment you put like steam bath in PubMed, we might not see many papers, but we see very many papers on sauna bath. Sauna bath is kind of dry heat. It is the dry heat what the if people are not getting a live streaming in YouTube, kindly share the link for Zoom. I don't know, like what's wrong with the YouTube streaming again. It just left off after 30 seconds. Anyway, let's continue with this. So this is in line with the previous findings on sauna bath. There are many studies done with dry heat. Sauna bathing is dry heat. Either it be the infrared rays or the hot stone where we just put the water application on it, like whatever it is. It is kind of dry heat, and many studies have been done before. This is one of the first kind of study done with proper steam bath. And the findings are similar to that of sauna bath. And mechanism of action. Right now, talking about the mechanism of action, excuse me. Now, we saw three things. One is increase in heart rate. The other two are reduction in blood pressure, systolic and diastolic. The increase in heart rate could be because of rise in blood temperature and stimulation of adrenergic cardiac receptors, right? Because of thermal stress, the adrenergic cardiac receptors gets activated, which increases heart rate. But the reduction in systolic blood pressure could be due to the autonomic regulation on the heart. As we previously saw, now the systolic blood pressure is all about a left ventricle contracting and ejecting blood out of your left ventricle, right? So it is about the heart pumping, and it is directly associated with your autonomic regulation. So probably because of steam bath, there is improved autonomic regulation. It could be due to the regulation of your parasympathetic or your vagal tone. And the next is your reduced diastolic blood pressure. That could be because of nitric oxide, endothelial nitric oxide synthase. And I remember when we saw about the GH pack, the mechanism of action of GH pack, during the hot application, what happens? There is a redness in the skin, right? So when there is a redness in the skin, what that means is there is peripheral vasodilation, right? There's peripheral vasodilation. So what that actually means is there is involvement of nitric oxide there. There are three types of nitric oxide synthase: eNOS, iNOS, and nNOS. eNOS is endothelial nitric oxide synthase. What we see here, E for endothelium. So the nitric oxide synthase, in the endothelium gets stimulated, and as a result of it, we see this peripheral vasodilation, right? So once the vasodilation happens, automatically the resistance, the peripheral resistance reduces, and that reduces our diastolic blood pressure. Okay, now systolic blood pressure is different from diastolic blood pressure. Whatever whatever parameters are changing, whatever parameters which are manipulating the systolic and diastolic blood pressure are different. Just like your FBS and PPBS, it is determined by completely different set of organs and different set of mechanisms. Even the systolic and diastolic blood pressure are governed by different things. Reduction in systolic, it's due to the autonomic regulation. Diastolic reduction, it's because of the vasodilation, which reduces peripheral resistance mediated by nitric oxide and endothelial nitric oxide synthase. Now, the ultimate question is, why is steam bath contraindicated in hypertension? Is it because of higher risk of further hypertension or sudden hypotension? So that is one big question. So when we were doing our internship, which is like good 15, 16 years back, during our internship, we were told, do not give liver 3.2 hypertension patients. Okay. So if at all you are giving, I mean, they have to lie down and then you have to give liver 3 point. So that's something different. But we are told, like, do not give that point to a hypertension patient. Our initial thought was that that might further increase blood pressure. That's what we thought. Until and unless we saw in a patient, while giving the liver 3 point in sitting position, automatically his blood pressure dropped so much that he fainted and fell down. Okay. So only then we understood, only then we realized the contraindication for hypertension need not necessarily be further increase in blood pressure. It might possibly be sudden reduction in blood pressure as well. Okay. Now, why we say that is, this is the baseline characteristics of the study participants. Okay. Now, this is the baseline characteristics. Here, the diastolic blood pressure is 75. Right, 75 mmHg is the diastolic blood pressure. What was seen in the patient, and remember, so the reduction from the baseline was as high as 10 mmHg. So the diastolic blood pressure is going to come down all the way to around 60 to 65 mmHg. So there is increased risk of hypotension or low blood pressure in patient, and that could be sudden. Okay, that could be sudden as well. So lot of caution needs to be taken, right? So that is, whenever you are giving steam bath either to a normal healthy individual or to a patient, caution needs to be taken. And the second thing, the results need to be interpreted with caution. Okay, as it is done in healthy individuals, it doesn't mean it is applicable even to heart patients, cardiovascular hypertensive patients, and other patients, right? Every individual person, every individual patient are different. Okay, so please do make sure that please do make sure that you're giving steam bath in a controlled environment along with proper monitoring. I mean, giving adequate water with the cold pack in the head and other things. Proper monitoring has to be done. Right now, the future studies on hypertension patients in controlled environment would be of greater value. Now, this particular study has opened new doors. New doors. Why? Because when you are trying to get an ethical approval, like if you want to give steam bath, say to a hypertension patient, if you are going to an ethical committee in your institution, they would be questioning you whether it is safe or not, right? Whether it is safe or not. For that, you can cite this paper saying that it actually reduces blood pressure, but we don't know whether the same effect would be applicable in hypertension patients, because that could be like what to say, any compensation or many compensation with the chemoreceptor, baroreceptor sensitivity, or whatever it is. We have a data showing that it is completely fine. It is completely healthy for normal healthy individuals. With this data, we can claim in an ethical committee that we want to do it on a hypertension patient because the safety has been established. The safety has been established. And I would like to, like, what to say, with an analogy of my own experience when diabetes study. So we wanted to check the effect of yoga on first phase insulin release. The acute phase, insulin is released in two phases. This first phase insulin release is very, very important as far as diabetes management or reversal is concerned. So we wanted to see whether yoga has any impact on first phase insulin release. Now for this, what we have to do is, in a diabetes patient, we have to inject glucose intravenously to the patient. Okay. Now, sugar patient, I mean, diabetes patient eating sugar itself, it's going to spike the sugar levels. That's unethical to give them a sugar meal or sugar drink or whatever it is. Imagine giving glucose intravenously. That is ethically, it is, we did not get the ethical approval. So what we did was, we found like what other population will have reduced acute phase insulin release. We found like first degree relatives and pre-diabetes patients have the same issue. So we did the study on pre-diabetes patients, right? So we found like no adverse effects. Now, citing this, we can show in the ethical committee that we did not get any negative effect or negative impact due to intravenous administration. Okay. Likewise, if you have a data to support your claim, it becomes much more easier to get ethical approval from your institution. Again, ethical committees vary from institution to institution. right? So few institution actually wants you to do study, and few institution want you to do like methodologically rigorous studies. It differs from one ethical committee to the other ethical committee. But if you are showing evidence, then they would be supporting you, right? Okay. Now the bigger thing is we cannot say or we cannot conclude anything just with one study, that with healthy volunteers. And I don't want to, what to say, finish the journal club only with that. So I went a little bit deeper into the literature search, right? So hydrotherapy, fighting fire with fire. Now, this is the paper. This is the paper what we are discussing now. So we found like systolic blood pressure and diastolic blood pressure reducing with steam bath. Done. Now, what is happening? As I said already, we don't have many studies on steam bath. So I've just taken the sauna bath treatment, which is somewhat similar, like more or less similar. And again, I took meta-analysis and systematic reviews here. What we found here is acute short-term efficacy of sauna treatment on cardiovascular function. This is a meta-analysis, right? So meta-analysis of previous studies have combined everything. And what we have found is the ejection fraction. The ejection fraction has actually increased by 3.27 percentage. Okay. So while giving the sauna treatment, what they found was ejection fraction increasing. Likewise, the systolic blood pressure, diastolic blood pressure, brain natriuretic peptide concentration, left ventricular end diastolic dimension, cardiothoracic ratio, everything improved, right? Everything got better with sauna treatment. And likewise, cardiovascular and all-cause mortality, sauna bathing and all-cause mortality. So this is again a prospective cohort study done on 2,315 people. What they found was the hazard ratio of sudden cardiac death was 0.78. That is, excuse the risk of sudden cardiac death reduced by 22 percentage. Right, the risk of sudden cardiac death reduced by 22 percentage for those who are taking 2 to 3 sauna bathing sessions every week. Right, and it reduced by like 63 percentage if they are doing it almost every day in a week. Even if you are doing it every day in a week, it was found to be beneficial, right? And similar association were found with CHD, CVD, and all-cause mortality. Everything was statistically significant. Okay, and the next question obviously would be like, what in case of patients with heart failure and other higher disease? Patients can take up to like 5 times a week. Even if you're taking 5 times a week, 2 to 4, I mean, for 2 to 4 weeks, it improved all cardiovascular parameter, right? And yes, it reduced inflammation and oxidative stress. This is all like large scale studies we are talking about. Done on 2,269 men, right? Age 42 to 61. So they found there's a reduction in inflammation and oxidative stress. Safety, talking about safety, sauna bath is performed once per day for 4 weeks in congestive heart failure patient. Now, this is exclusively to determine the safety and efficacy. Now, as far as we as doctors, the first and foremost rule is do no harm, right? Do no harm. That is first and foremost of the what to say, the Hippocrates oath, what we are taking. Whether we are able to help the patient or not, please don't not harm the patient. So that is what we are very much careful, especially we as yoga naturopathy consultant, we are very much particular about that. So one thing we have to notice about the safety and efficacy, right? Safety and efficacy of sauna bathing in chronic congestive heart failure patient itself found that it was safe and it improved the symptoms and exercise tolerance in chronic congestive heart failure patients. All right. Okay, now this is like kind of overview or the mechanism of how it is beneficial. We already saw that when we spoke about effect of hydrotherapy in diabetes. So once again, I'm just reiterating here. The heat stress, right? The heat stress and shear stress actually improves the nitric oxide synthesis, right? So what this nitric oxide does is excuse- it improves the heat shock protein, right? It activates the AMP kinase pathway, and through like plenty of other pathways like glucose transport, mitochondrial biogenesis. Through that, it reduces lipolysis, body fat, reduces inflammation, and again, inflammatory pathways. It reduces the inflammatory pathways as well. Okay, so these are like one screenshot of what actually happens when you're giving a hot application as such. Okay, and again, the heat therapy can be given respecting the contraindications. So, and then the obvious question would be, what is the contraindication? We don't exactly know like what the contraindication is. We generally believe like it might increase the blood pressure, and studies clearly show that it is not actually increasing the blood pressure, but caution needs to be taken when you are dealing with hypertension patients. Okay. All right. Yeah. Thank you. Thank you so much. So if there is any questions as such, kindly to put it in the chat box. I think our next presenter is ready as well. So we'll start with Chaman Baba. If you're ready with your presentation, we can start.
Yes, sir. Ready, sir.
Yeah. Share your PPT, please. And Chaman Baba, student from Atti College. So what is it? I think I've introduced him on the very first day as well. Atti College, Gudiyathum, Tamil Nadu. So he's very much interested in
Sir, is
evidence-based
it visible, sir?
learning. Yes, as started screen sharing. Yes, can start your presentation, please.
Okay, sir. A very warm good evening to one and all present here. I am Saman Baba. So today's topic is about, we are going to discuss about the effects of cold abdominal pack on the blood glucose levels and cardiovascular patients in type 2 diabetes. So it was presented by authors such as Suvit Vidas, Muvendan sir and N.K. Manjunathan sir. It was a journal from the Journal of Clinical and Diagnostic Research. So we are going to see first what are the abstracts which we are going to see. Yeah, abstract. So introduction. So what about the introduction is we everyone know that important disease which are caused in nowadays with the several patients. So first of all, the hydrotherapy treatment which we giving the cold abdominal pack is used for various metabolic disorders. So the main thing is type 2 diabetes mellitus. So this main research is to evaluate the immediate effect of cold abdominal pack on blood glucose levels and cardiovascular functions. So the background is prevalence. So in 2011, there are 366 million people were affected by type 2 diabetes. It may increase up to 2030, 552 million in 2030. The study and methods and the study design is a single group of pre and post test design was adapted, and the subjects were underwent a single section of cold abdominal pack, the duration for 20 minutes. So the assessments were taken before and after the intervention. So why we are taken before and after the intervention means to which are used in this research is total of 20 type 2 diabetes male patients with the age of voice is breaking, sir.
Yeah. Continue.
Sir?
Yeah, continue.
Is it clear, sir, now?
Yeah, continue.
Okay. Next, the criteria, the inclusion criteria. As a male subjects with the history of type 2 diabetic mellitus patients are the inclusion criteria, and the exclusion criteria, the people with type 1 diabetes sensitive to cold, and the persons who are went for cold abdominal pack for past week. So why we are excluding the type 1 diabetic patients is the important thing, the inclusion criteria as well as exclusion criteria. It is because that pathogenesis, etiology, and causes of the type 1 and type 2 diabetes mellitus patients are quite different from one another. So the effect on them are also differ based upon the treatment which we are giving. And the prevalence of the type 2 diabetes mellitus is more than that of the type 1 diabetes mellitus. So that we are using only the male subjects with the history of type 2 diabetes mellitus. Next, the intervention. The cold abdominal pack which we are using is a wet cotton towel which is dipped in cold water and wrapped around the abdominal region. Its duration is around 20 minutes, and assessments need to be checked before and after the cold abdominal pack. So what we are taking during this research analysis are the random glucose level, blood glucose, pulse rate, mean arterial pressure, and the rate pressure product and double product. These were calculated during the cold abdominal pack. And the results. So there were a significant reductions in random blood glucose level and systolic blood pressure, except the mean arterial pressure and double product. So why there is not a significance in the mean arterial pressure and double product is due to while applying cold abdominal pack, there is a arterial constriction around the cold abdominal pack regions. So it doesn't cause any significance in the mean arterial pressure and double product. So these are the reasons why they are not reducing while practicing cold abdominal pack. So next, discussions. The mechanism which were during the reduction of blood glucose level as well as using cold abdominal pack are follows. The utilization of glucose by increased metabolism. The first of all, while we are applying cold abdominal pack throughout the abdominal region, so cold is induced in our body. The cold which induces the thermogenesis. We have a regulated mechanism to set the temperature. So when we are exposed to cold around especially our abdominal region, the thermogenesis is happen, and it is an ability to generate heat by increased metabolism in response to cold metabolism. So to maintain a stable body pressure is a basic property of our human beings and thermoregulation. So the areas which we are applying the cold abdominal pack, cold are which peripheral vasodilatation, peripheral vasoconstriction, and leads to visceral vasodilatation. The visceral organs gets more amount of blood, and which in turn increases the metabolism of the glucose which is stagnant around the area, and it utilizes the glucose by increasing the metabolism. So the second one is increased insulin release to the activation of adenosine triphosphate. So the potassium channels plays a major role in the many tissues in such as pancreatic beta cells. These channels became the target for sulfonylurea drugs which is present in our body. So the sulfonylurea drugs which we are giving during the treatment of the type 2 diabetes mellitus, which regulates the glucose in our body. So by regulating this membrane, the potassium gets effluxes from our body. Due to membrane hyperpolarization and suppression of the electrical activity in which the metabolism reduces. Conversely, during the closure of the potassium channels followed by the membrane depolarization, stimulation of electrical activities increases as the metabolism increases. So due to the potassium efflux, the calcium ions which are presented in our extracellular fluid and presented in our body tissues are easily absorbed in cellular levels. So the absorption of the influx and absorption of the calcium level, which leads to the increased metabolism as well as aids in reducing the pancreatic permeability and leads to excess production of the insulin from our pancreatic beta cells. So the third point is increased insulin sensitivity. Hyperinsulinemia is the common with the patients with type 2 diabetes mellitus due to increased insulin sensitivity. While the cold abdominal pack, which is given in the abdominal region, has suggested that it is an improved glycemic control over for type 2 diabetes mellitus. So 10 days of cold abdominal pack, which increases the insulin sensitivity up to 60 degree, in which the GLUT4 receptor, which is called as glucose transporter, which is present in the cell membrane of the cells, which helps in the transport of glucose molecules in the blood to the cells. So the transport of glucose and blood from the outer to the inner cell is taken out by the GLUT4 molecule. So inducing of the GLUT4 molecules helps in absorption and metabolism of the insulin, which increases the insulin sensitivity. Then the fourth point is activation of transistor receptor potential melastatin like 8 ion channel by brown adipose tissue. Our body has consists of two types of adipose tissue, which you are briefly known as white adipose tissue and brown adipose tissue. White adipose tissue consists of a very small amount of mitochondria, whereas the brown adipose tissue consists of high amount of mitochondria. So while applying cold to the abdominal region, it is reported that the potential therapy by diabetes has by decreased during by the brown adipose tissue. So by applying cold to that abdominal region, induces brown adipose tissue, which have high metabolic and produces high amount of energy. These high amount of energy, while exposed to the cold, will increase in the metabolic heat production, which is divided into shivering and non-shivering thermogenesis. Shivering thermogenesis is activated during high cold expresses, that is when we are exposing to minus cold degrees. So non-shivering thermogenesis is activated during a very small amount of cold while we are exposing. So while applying cold abdominal pack, non-shivering thermogenesis is happened. By the non-shivering thermogenesis plays a major role in heat production around the abdominal region. So the increase in the heat production plays a major role in activation of the brown adipose tissue, whereas the brown adipose tissue induces the exposure of metabolism and increase the glucose absorption. So conclusion. That 20 minutes of abdominal pack has a major effect in reducing blood glucose levels and cardiovascular functions. So, thank you. And the results was mainly in this, that if for a smaller period of time, 20 minutes is have a significant reduction in blood glucose levels in cardiovascular functions. So as we practice it for several days, it will leads to a tremendous reduction in the blood glucose level, as it leads to as it will lead to eradication of diabetes in type 2 diabetes. Thank you.
Thank you so much. I can see you put a lot of effort into this. And for those who don't know, Chaman Baba, I told like he's from Ati College, Gudiyatam, and he's a first year student, right? So he's a first year student with great enthusiasm. He has read into the mechanism of actions as well. And he has referred a lot of things as far as mechanism of actions are concerned. And he was so enthusiastically for the past 2 to 3 weeks, he kept asking, I want to present. Thank you so much for your enthusiasm. I'm sure like you would have motivated many others as well. Long way to go. Thank you so much. Brilliant explanation indeed. Thank you.